On Thursday, May 18th, community partners gathered to learn about the progress of the Opioid Settlement Steering Committee. Since 2017, the number of fatal overdose deaths in Buncombe County has remained consistently higher than the North Carolina state average. In 2021, the Buncombe County Board of Commissioners entered into an agreement with other state and local governments to recoup needed resources and provide relief to communities impacted by the opioid epidemic. Through this agreement, Buncombe County will receive over $16 million across a 17-year period as a part of the opioid settlement.
This moment in particular is so critical because we are embarking on a new phase of our work fueled by opioid settlement funding that will enable us to scale programs that have been launched as nimble, innovative pilots, have shown great efficacy and are now ready for the next phase of work. Funding that will enable us to launch new initiatives in response to the ever-changing landscape of needs at the community level, and will enable us to continue being what we have been in Buncombe County, which is a pace setter, not just at the state level, but at the national level in terms of how communities can come together and respond.
Starting in September 2022, a steering committee made up of partners from over 40 community organizations helped define the vision and strategies for utilizing these funds. Highlights of their report include results from 31 feedback sessions with stakeholders, along with 1,100 surveys from community members. Key findings of the report prioritize data coordination across agencies, collaboration, and people-centered services. Strengths, gaps, opportunities, and challenges were identified and recommended strategies for funding were provided. Some key recommendations include increasing funding for the community paramedic program, naloxone distribution, and increased behavioral health resources. A panel discussion covered topics such as root causes, barriers to treatment, which include access to safe housing and transportation, and issues for youth struggling with substance abuse disorder. Community partners are committed to supporting the work through an emphasis on coordination, communication, and data-informed decision-making across public safety and public health infrastructure. Next steps for the opioid settlement planning team include evaluating projects for funding decisions and monitoring success. Watch the entire event or learn more about opioid settlement funds by visiting engage.buncombecounty.org/U8734